We've been holding these town hall meetings, for lack of a better term, over the last couple weeks, and I think it's always good to have a two-way conversation. From time to time, you see maybe every couple of weeks, I'll send out a snapshot note, and you'll see another one this afternoon, hopefully. That can be kind of a one-way communication. Sometimes I get responses from staff about those, and they've been received positively, but I'd much rather you hear about the future strategy of the hospital and where we're headed this year in particular from me or from your directors or from your supervisors than just word on the street. So that's why I think it is important to get out in front on some of the stuff. So we do have a few things to talk about. I swear I'll try not to talk for over 10 or 15 minutes and leave 10 or 15 minutes for discussion from you all, see what's going on. Make sure we keep Wayne and Larry under control in the back, particularly Wayne, right? But first and foremost, quality is on my mind, and I think that has to lead any strategy. And I was kind of reminded of that Ford commercial. I think it was Ford back in the late 80s. Chris, you'll remember this. You were like 10 or something. Late 80s or early 90s. Or Wes was like 10. Maybe not even born. Yeah.
Yeah, maybe like
4. What was the slogan they used regarding quality?
Goes in before the name goes on.
I don't remember that one. I think I was 4 then. There was another one I was thinking about. What else related to quality in Ford? Who remembers the one I'm thinking? No, I've heard that one. But yeah.
You must be a Chevy guy.
Yeah, he's a Chevy guy. Quality is job one?
Oh, yeah.
Yeah, that's the one I remember. But I'll take yours too. It's hard to remember, I think. But when you look at Joint Commission and the accomplishment we had with Joint Commission earlier this year, I think we're well on the road to quality. Joint Commission, for the second year in a row, named us the top performing hospital because of our core measures results. And we have a lot of departments and physicians chasing those core measure results. The inspection went just tremendously well. The physician inspector, when he left, said it was the best inspection he had done in 5 years of any of the hospitals that he had inspected. And then we followed that with our Joint Commission certifications of our total joint program, congestive heart failure, and stroke programs. All of those were almost flawless. I mean, just amazing work by all the staff and physicians, a testament to what we're doing from a quality standpoint. But I was thinking about that and had a question for the group last week, and I would have the same question of you guys, is what is it that patients think about when they think about how good a hospital is? What is it, what are the characteristics that they're, besides just their neighbor told them to go there or told them not to go there, what's important to patients when it comes to?
They like hospitality.
Yeah, hospitality, yeah. A smile, yeah, good customer service. What else? Communication, what's going to happen next?
Right.
Studer taught us that in the ADIT training, right?
Mm-hmm.
Duration, yeah.
Keep them informed.
Keep them informed. What's important to your patients in PET CT, Wes?
Like a sense of relationship between themselves and their caretaker, just really.
Yeah, a connection.
Yeah.
Yeah.
Intimate type of connection.
Yeah.
It's not just, they're not just here getting a job done.
Yeah, yeah. This is my third PET CT patient
Right.
coming in.
Right.
No, that's Mrs. Jones.
Right.
She has a first name too. Yeah. What about our physician practices?
I think timely care, they make a phone call, they need to be seen.
Yeah.
Come in.
Our cancer center, what's important? Trust, yeah. That beam of radiation is going to go to the right spot, right? Competency. Yeah, that would concern me. Yeah. Yeah. So nobody mentioned Joint Commission. I just spent 5 minutes lauding you all about Joint Commission and you didn't mention it. What's the deal? Is that not important?
I think to the layman patient, it's hard to kind of transition what Joint Commission really does for a hospital and how they, what their role is for the hospital. You could say Joint Commission to, they're not going to really
Yeah.
put two and two together. What
Yep.
that actually means.
When's the last time you went to a restaurant and checked their health department standards?
Right.
Why
Just a
don't
sticker
you?
on the front door.
That's it.
Yeah.
It's on the front door. You look for that, right? Just like our certifications on, in the lobby, right? We post it.
You don't go in.
I mean, it's a minimum standard, right? I mean, everybody, you're either passed with the health department if you're a restaurant, or you're not in business. Same with Joint Commission. You either pass or you're not in business. So, kind of there's no in between. But with customer service and information, timely care, there is an in between. So we're judged on that every day. And I think that's where we need to go in 2013 is talking about and relearning a lot of the things that from a patient perspective are important. Because we can hang our hat on Joint Commission all day, but it's not the end all be all. It's how we treat and connect with each of those patients, I think, is probably what's going to be, that's where the rubber meets the road. So the AIDIT training that you did, so who remembers what AIDIT stands for? We did a lot of this last year. Acknowledge the patient. It's important that the patient knows that we knew they were coming. And even if we didn't know they were coming, they're going to feel welcome. Gosh, you weren't supposed to be here today, you're supposed to be here tomorrow. Yeah, that's not going to make me feel very good. I'm not coming back if they say that. They don't know what they're doing, right? And then introduce yourself, make that first impression. You got 15 seconds, that's all you got. That's not very much time. And then what's the D stand for? Not because I forgot, I'm just testing you. Duration. That's why we have the ER billboards all over the place in town, because duration is very important. How long is it going to take? When am I going to, when nursing gets this question all day, every day. Dale knows this. When's my doctor going to come see me? I haven't seen the doctor yet, right? Yeah. And then E, what's the E stand for? Explain. You guys went through this training. Come on, you just needed that memory, right? Yeah. And then thank them. And something I hear a lot of our staff do, and I know a lot of you all do this too, is asking the patient if there's any, along with the thank you, is there anything else I can do for you? But what does that say to the patient?
Let's give them a chance. Is there anything else they need?
Yeah.
I think you care.
Yeah. Kind of welcoming. You've got the time. That you care is what I think it definitely shows. That's important. So we'll do some more work on that. We're actually going to include some patients and patient family members on some of our committees, our patient satisfaction committees, to gain greater insight. Use our Gallup surveys to gain greater insight, because we're about average. We're really, really good at Joint Commission and compliance with core measures. We're in the top 15% of all hospitals in those areas. But we're about average in patient satisfaction. So we want to work more on that and really improve our outcomes. The other things we're working on, we just got some really good news from the state. We were approved for a freestanding emergency department in North Charleston. We're going to put it halfway in between here and West Ashley. So where does that, this will look just like the Moncks Corner Medical Center, freestanding ER, 24/7 ER, be open next year. Where does that put you if you're halfway between here and West Ashley? What was that? Yep. Tanger Outlet, Convention Center, highly traveled area, and really there's no emergency care kind of between Northwoods and West and St. Francis. So it's kind of that middle area where we see it. There's a lot of traffic and a lot of need. The state approved us without any questions. We didn't receive any opposition from any of the existing providers, which both of those things tell us that we think we're doing the right thing there. And of course, we were approved for the cancer center and a new linear accelerator. The state approved us there. So both of those projects we're seeking corporate funding. And we'll have some people here next week from corporate to look at that and hopefully to give our, get a commitment from them that we'll get that financing. In total, that's probably $12 million worth of financing between both those projects, maybe 13, 14. So we're excited about that. We also want to expand in some other areas, in Larry's area, with some rehab beds, inpatient rehab beds, which would make Larry's group very busy, much more extensive rehab than we're able to provide inpatients. These patients are ready for rehab, not just ready to get out of the hospital, but ready for more extensive rehab. And what we're finding is that some of the existing providers, HealthSouth and others, are getting full and also can't take on some of our more medically complex patients because they don't have the same physician complement that we have. So we have cardiologists here, we have pulmonologists, whereas they don't. So we think that would be good. That would be most likely located on the 4th floor and looks like about 14 beds. So we're going to seek state approval for that. That application's already in, and then seek state approval for, drum roll for Kathy, for behavioral health beds, 18 beds. And it looks like at this point that we won't have any opposition from Life Management, from Palmetto on that, which is good news. We're working with them. They're going to expand. They're looking to expand as well. And that would be located. Anybody have any guesses besides Kathy? She's probably already heard. Administration. Kind of the same patient population, right? We're going to the electronic medical record, so we'll have extra space in medical records where we're currently housing a lot of the paper records. So administration likely would move there. But those are both next year projects. Hopefully we'd get started sometime this year and finish next year. That would expand our bed capacity to well into the 300s, probably around 330 bed capacity, which will help us grow, help us grow with the community for sure. But the other good news from an employee perspective is we're investing in an employee health clinic. This would be an on-site clinic that would take care of us and our family members, and it would be staffed by a nurse practitioner and a health coach. There wouldn't be a cost to that. Actually, Catherine is helping to start that up along with H2U and HCA. Some HCA hospitals, including our corporate office, have opened an on-site clinic, and they've seen it be just a tremendous success. Easy access, then going to our physician, and they could treat not only kind of colds and flus, but also chronic conditions as well. So we're excited about that. If you don't have our insurance, there would be a fee, but if you do have the insurance, like I said, there would be no cost, which is really good. Yeah. And Catherine and others are saying June. I'm telling you summer, because that gives me some wiggle room. Are you okay with that?
We're working hard, but I like summer.
And really, we're jumping off of two things when we're looking at starting this clinic. The first is, as evidenced by our health screenings and health risk assessments, we know that healthcare employees are not always the most healthiest. And we access ER services more often than the typical employee out there with other industries. We use healthcare more because it's more accessible. So obviously we kind of preach to our patients, see your primary care physician and seek that preventative care. That's important so you don't end up in the ER, which can be more expensive for you. We should also be doing that for our employees. So this is a way to do that. And then we also want to try and sell this service to the Boeings of the world, City of North Charleston, and maybe have them start on-site clinics as well, and we would help set those up and then obviously have that relationship with them. So figured we couldn't really sell it unless we also had it here on site, and we're doing it ourselves.
Where's that clinic going to be?
Yeah, right behind, or right across the street from Trident Family Health. So it's where Dr. Benner's office used to be. Dr. Slott's weight management clinic is there. I'd point to it, but I think it's
That direction.
past the ICU, right by the cancer center. Yeah, the cancer center is probably closest to it. Yeah. So that's kind of everything that is going on from a strategy perspective. A lot of things going on, really, and that's the reason why I felt like it was good timing to come talk with you all. I mentioned that we are starting an fully electronic medical record. That'll start in June with our physicians fully documenting in Meditech. We'll go to a new version of Meditech. And there's been a lot of staff already being pulled out for training, super users, and what's the other terminology we use? Not super, it's beyond super users. It sounded really nice though. I think I wanted that title, Master Trainer. I wanted that title. That's kind of a cool title. But I've been kind of joking around with staff, particularly nursing staff. If you're around a nursing station in the month of June, put your earplugs in, because we are in for a transition with our physicians. A lot of them are not using the computer now. They're very tied to the paper record, and that's going away. Of course, we've seen that in a lot of different departments. The ER has gone fully electronic, and that took a month or two to get kind of through it, and still seeing some bumps along the way with transition. So, Cancer Center, it's gone 90% electronic.
No, 50.
50.
We still,
Too much paper.
So much stuff to send the medical records to be paperless.
Yeah, yeah.
Will that go away for us? That'd be wonderful.
No. It'll help. Yeah, it'll help. What questions do you all have for me? I was gonna mention this, Diane, but go ahead. I was gonna mention our new name badges.
Is there any news on the hospital in Berkeley County?
No, nothing new. We're still seeking a date for an appeal, and actually seeking approval to get into the appeals court first and foremost. So our lawyers have been busy making briefs to the judge with the appeals court to make sure that we get in. We think we'll get in, just not sure of the date. As part of that, Roper did appeal the 30-bed addition at Somerville, and they have, as of last week, dropped that appeal, which is good news. Yeah, so we're free to go on those beds. But the best rumor I've heard is what about these new name badges? You guys have heard it, haven't you?
It's tracking you everywhere we go.
Exactly, just you, just you.
We got a GPS locator inside them.
Right.
Really?
Isn't that crazy?
That's why we can't poke holes in it.
You can't poke holes in it or it won't work. But there is no GPS tracking device in here.
That's good.
I can tell.
100 staff, just keep track of the.
Yeah, we have no time to keep track of it.
But it can't
Yeah.
tell you how many times you wash your hands.
It can't yet.
Not yet.
Only at Somerville. And they have an additional attachment to allow them to do that. We will have that at Trident. That's gone so well, that pilot, for the last year. It's increased hand washing compliance from 50% to over 70%. We know we can get even better with that. It's kind of a cool tracking system. Yeah, just a good reminder to staff. Yeah. Yeah. But we're only tracking Wayne with these. What else is going on?
You said that we have been approved for the beds, for the psych beds?
No.
We're in the process of working on that stuff.
We've finished the certificate of need, and we've worked with Palmetto to, because originally we wanted to go after 20 beds. We worked with them to reduce that to 18, so we don't think we'll face a challenge, which is the best thing. Probably put that application in with the state next week, and probably here within the next 45 to 60 days. What's going on?
5 days.
Yeah. And then we've got to get corporate funding, because kind of where we're at with the freestanding ED and the cancer centers to seek corporate funding after that. So we, by by the fall, we should have a much clearer picture of when and how. I think the psych beds CON will go a lot easier, and corporate funding will go a lot easier than the rehab.
I think it will go unbelievably.
Quick.
They
Yeah.
need psych beds bad all over the state.
Yeah, I agree.
It's a huge need.
Yeah. And we're transferring how many patients to inpatient care from our ER a month? Is it a couple hundred? A
In
month?
the 2 hospitals,
Yeah.
to inpatient, probably about 100,
About 100?
yeah.
Yeah. We know that to be able to fill about 15 beds easily each day. Yeah. It'll be good.
Yeah, because there's some people that wind up getting treated here and sent home after a few days that would have gone inpatient, but there were no beds available.
Yeah. Yeah. So it'll utilization will probably increase.
Right.
Yeah. It's a good point.
She's talking about behavioral health patients.
Yeah. Yeah. Kathy leads our social team that works with those patients in finding placements. And so what we're finding is most of our patients that need inpatient care, particularly if they're unfunded or have Medicaid funding, are staying here anywhere from 1 to 3 days extra in an ER hold status. So they're not even placed in a full-fledged acute care bed. Yeah. Because we can't. We don't have inpatient beds. We're not licensed for it. Other things going on? Anything going on across the street? In these town hall meetings, I've heard a lot about the duck crossing signs that we need. There's worry about the duck health,
That was
the
my
duck health
EDC
population.
comment. They wanted to make sure they were going to take care of these ducks.
Yeah. Yeah, somebody sent a picture of a hawk that took out a duck.
Yes, in front of the ER.
Yeah, and supposedly it was a live duck.
Well, he was when he started on it.
Sure, yeah. But it wasn't one that got
He was
hit.
not leaving that duck.
It wasn't one that got hit by a car.
I mean,
No.
a man tried to hit him with his jacket, hit him with a water bottle, and
No.
that hawk was not going anywhere.
No, that's a red-tailed hog.
Yeah, it's, it's a food chain.
Yeah,
Yep.
circle life. What about supply chain? Anything going on, Chris?
You guys opened the floodgates on the capital budget this year.
We did.
A lot of stuff. 52 beds coming here May 1st.
Yeah.
20, I think, over some. Saw a laundry list with the surgical growth initiative come across today.
Yeah. Yeah, I think it's a couple $100,000 worth of equipment there for the operating room. That'll be good. Anybody have a guess what a regular med-surg bed costs these days? How much? 8,000. 12.
We got it down a little bit below 6.
6,000.
ICU was
Yeah, ICUs are about 12, aren't they? Yeah. So you can buy a boat or you can buy a bed. Amy wants a boat. Yeah. Anything else going on? Anything on our physician practices?
Just, we're trying to stay as busy as we can.
Yeah. It's not hard these days. Yeah. Good.
You're right about their reaction to the electronic records. The ER was grumbling for a long time.
Yeah,
Yeah.
Yep.
It's a hard transition for them.
definitely.
Creatures of habit.
Yeah, yeah. In the ER case, it felt like we went from a pretty good product to one that maybe wasn't as good either. They were used to some T-system documentation's pretty strong, but it didn't talk to Meditech, which was the problem.
Right.
So we gave up one function to get another. In this case, our physicians would be going from paper to electronic. May not be as hard of a transition, but we're preparing for it to be hard.
Our physicians,
Go ahead.
When will they implement the new Medicare? When will that start?
End of May.
End of May?
Hmm.
We haven't heard anything about that yet, so we have to. 'cause it
You have now.
Yeah, but it's not a lot of Medicare users down in the cancer center, but I guess.
Yeah.
I mean, we read things.
Yeah, other than the order entry component, I'm not sure the version's going to change much for you guys unless you're ordering. Okay. it may look the same to you.
I just have a question. You were talking about, how important it is, those first people that our patients or families see, as far as greeting them and kind of helping them get into the system or in the door, so to speak. Is there any progress or anything going on getting valet back between the ER and the cancer center to help people?
There's really not. What we've done is tried to improve the parking back there by reserving more spots for our cancer patients close to the building. But what we found is the demand wasn't high enough. There was a lot of downtime for that valet service. So we tried to concentrate it all at the front and take those valet folks to the front too. So we have 2 on most of the time up front, which is pretty convenient for the patients. But obviously that's a 4-mile hike. I call it the 4-mile hallway. It's pretty tough going all the way back, yeah.
With the people that have anemia or weak, just got a call away and there's nobody out there, just help them out. Well, if they ever think about bringing it back again, I think they might need to think of peak times.
Yeah.
Before 1 or 2 o'clock, because most of the infusion people are in the chairs and getting their blood and stuff by that time. So even if they gave 4 hours,
Yeah.
if somebody back there would be a big help.
That's a good point. We've certainly gotten busier with infusion and radiation.
Yeah, and if there's 10 people back there, they're gonna stay.
And they're there for a long time, so those 10 spots can be held up for 5 to 6 hours.
Yeah.
And so I just feel like if I was a patient, that'd be kind of a hard thing for me to have to deal with every single day as a radiation patient.
Yeah.
But even for 4 hours, I think.
Would help.
We find them like straggling in, like going to clock in and out and having to run and get wheelchairs for them. So it's a big deal.
I just think that's almost like neat. Somebody to grieve and say, what can I do?
Yeah. Acknowledging our patients. Yeah.
You go to Walmart, they're practically, get you coming in the door or something, and that's just Walmart. You feel pretty good.
Yeah. Yeah.
I don't know, I just thought even some time better than no time.
That's a good point. We'll look at that. Diane, did you have a question?
Or even a volunteer.
Yeah.
Being a volunteer.
For the community, or not the community, but the company clinics that you're thinking about establishing, would they all be ran by nurse practitioners, or will it be, like, if you do develop one at Boeing, would it be Trident employees that would staff that, or would it?
It'd actually be HCA employees. Yeah. So yes, Trident, essentially, affiliated with us.
Right.
It's kind of like our physician practices. They're not directly tied to Trident, but tied to the same employer. So yeah. And not all by nurse practitioners either. Some physicians,
Okay.
as it grows. Yeah, it should be good. So June, right, Catherine?
So you said your family members, but they have to be covered under your insurance?
Yes.
Or they have to pay a small fee.
Yeah. Yeah. And
Would you file, this was a question a lot of people had. If they have an insurance with, like through their dad's, would they file insurance through their dad's insurance with a co-pay like you normally would when you went to the doctor?
I'll have to check on that. I don't think so, because I think it would
They
be.
would just pay a flat fee?
Right, it's either, if you have our insurance and you carry your, it's zero, and if not, I think it's a flat fee. I think it's around, it's $75.
yeah, I think that's what I've heard too.
Filing of insurance.
I think you could file insurance on your own, but the clinic wouldn't.
I gotcha.
It'd be more like a minute clinic that's cash only.
Was
A
there,
lot of people
was
ask that.
the HTU program that they had, with all the trips, and will that stuff be still available? Or
Yeah.
is that going by the wayside?
No, that program is kind of expanding beyond a seniors population and going to
Right.
encompass, kind of all friends of
Everything.
Trident, if you will. Yeah, and yeah, I think the structure of it will be separate than from the clinics. Yeah.
Todd, is it gonna be open for volunteers?
Yes. Yeah, it'll be open for the volunteers, but you'll have the same requirements as somebody that doesn't have insurance. It'd be the $75
The
fee.
main thing for us is being able to get something.
Yeah, something quick and convenient. Yeah. Yeah.
Most of us are covered somewhere else, anyway.
Right.
Most of us are retirees, so.
Medicare. Yeah. Yeah. And I think I'm right in that, Catherine. It is open to the volunteers. Yeah. Trident Health Family. Yeah.
You won't be going to bed.
Yeah. Definitely. Well, thank you all. I really appreciate your time and attention. You know, spread the word about some of these things. We've had some really good attendance at these meetings. This included. I think we're upwards of about 200 of our employees that have attended one of these meetings. So that really does help spread the word about what's going on.